Which of the following is the most common type of ventricular septal defect? A. Muscular VSD. B. Paramembranous VSD. C. Supracrystal, inlet, VSD. D. Doubly committed VSD. Answer: B. Paramembranous VSD. A 4-week-old infant presents with a harsh, holosystolic murmur heard best at the left lower sternal border. What is the most likely diagnosis? A. Ventricular septal defect. B. Atrial septal defect. C. Patent ductus arteriosus. D. Coarctation of the aorta. Answer: A. Ventricular septal defect. In a patient with a large VSD, which heart chamber is typically the first to undergo dilation due to volume overload? A. Right atrium. B. Right ventricle. C. Left atrium and left ventricle. D. Pulmonary artery only. Answer: C. Left atrium and left ventricle. What is the primary hemodynamic consequence of a small, restrictive VSD? A. Rapid development of pulmonary hypertension. B. Cyanosis at birth. C. High pressure gradient between ventricles with minimal shunting. D. Right to left shunting. Answer: C. High pressure gradient between ventricles with minimal shunting. Which of the following describes Eisenmenger syndrome in the context of an unrepaired VSD? A. Spontaneous closure of the defect. B. Development of bacterial endocarditis. C. Reversal of shunt, right to left, due to permanent pulmonary hypertension. D. Development of aortic regurgitation. Answer: C. Reversal of shunt, right to left, due to permanent pulmonary hypertension. Which ECG finding is most characteristic of a large VSD with significant left-to-right shunting? A. Left axis deviation only. B. Right bundle branch block. C. Biventricular hypertrophy, Katz-Wachtel phenomenon. D. Prolonged PR interval. Answer: C. Biventricular hypertrophy, Katz-Wachtel phenomenon. A malalignment VSD is most commonly associated with which complex congenital heart disease? A. Transposition of the great arteries. B. Tetralogy of Fallot. C. Ebstein's anomaly. D. Tricuspid atresia. Answer: B. Tetralogy of Fallot. What is the first-line medical management for an infant with a symptomatic large VSD, congestive heart failure? A. Beta blockers. B. Diuretics, e.g., furosemide, and potentially afterload reducers. C. Digoxin alone. D. Immediate heart transplant. Answer: B. Diuretics, e.g., furosemide, and potentially afterload reducers. At what location is a supracrystal VSD located? A. Near the tricuspid valve. B. In the apex of the heart. C. Below the pulmonary valve. D. In the middle of the muscular septum. Answer: C. Below the pulmonary valve. Which complication is a patient with a small, restrictive VSD at a higher risk for compared to the general population? A. Heart failure. B. Infective endocarditis. C. Eisenmenger syndrome. D. Exercise intolerance. Answer: B. Infective endocarditis. Which of the following physical signs suggests the development of pulmonary arterial hypertension, PAH, in a VSD patient? A. A louder holosystolic murmur. B. A loud, palpable second heart sound, P2. C. Disappearance of the thrill. D. Increased peripheral pulses. Answer: B. A loud, palpable second heart sound, P2. When is surgical closure usually indicated for a VSD? A. For all muscular VSDs at birth. B. Failure to thrive or persistent heart failure despite medical therapy. C. When the shunt ratio, QP/QS, is less than 1.5. D. Only if the patient becomes cyanotic. Answer: B. Failure to thrive or persistent heart failure despite medical therapy. A patient with a subaortic VSD develops a new early diastolic murmur. What is the most likely cause? A. Mitral stenosis. B. Aortic regurgitation. C. Pulmonary stenosis. D. Tricuspid regurgitation. Answer: B. Aortic regurgitation. What percentage of small muscular VSDs close spontaneously during the first year of life? A. 10%. B. 25%. C. 75 to 90%. D. 5%. Answer: C. 75 to 90%. On a chest X-ray, which of the following is not a typical finding for a large left-to-right VSD shunt? A. Cardiomegaly. B. Increased pulmonary vascular markings. C. Boot-shaped heart. D. Prominent pulmonary artery segment. Answer: C. Boot-shaped heart.